Hello, everyone, and welcome. I'm glad you're here today. We're about to dive into some important preparation material. Today's focus is on the Qatar Prometric exam for Nursing Foundation, Part 4. This is the first slide, so I just want to give you a quick overview of what's coming up. We'll be looking at updated questions, including those in Prometric style with options and answers. Over the course of this presentation, we'll review some practice questions to help you prepare effectively. So, let's get started and make this session both informative and engaging. Let's focus on hand hygiene. This is one of the most critical steps we can take to prevent cross-contamination. Proper hand hygiene includes thoroughly washing our hands with soap and water or using an alcohol-based hand sanitizer whenever necessary. It's especially important before and after patient contact, after touching surfaces, and when moving between different tasks. Remember, clean hands are our first line of defense against the spread of germs. This simple yet effective practice helps protect both our patients and ourselves. So always make hand hygiene a priority in your daily routine to maintain a safe and healthy environment. When evaluating signs of dehydration, one of the key indicators we look for is dry mucous membranes. This occurs because, with dehydration, the body loses significant amounts of water, leading to decreased moisture in the tissues of the mouth and throat. It's a subtle but important sign that can often be observed during a physical exam. In contrast to other signs like edema, which indicates fluid overload, dry mucous membranes specifically point to a deficit of fluids in the body. Recognizing this helps us quickly assess a patient's hydration status and determine the urgency of intervention. So, in the context of dehydration, dry mucous membranes are a crucial clinical sign to keep in mind, as they often appear early and can guide our decision-making in managing the patient effectively. The correct answer here is 1.01 to 1.03. When we talk about normal adult urine-specific gravity, this range is considered typical. It reflects the kidney's ability to concentrate urine appropriately based on hydration status and other factors. If the specific gravity is within this range, it generally indicates that the kidneys are functioning well in maintaining fluid and electrolyte balance. Values outside this range could suggest issues like dehydration, overhydration, or renal impairment. So, understanding these normal values helps us assess kidney function effectively as part of overall health evaluation. All right, so when it comes to treating opioid overdose, the key antidote we use is naloxone. Naloxone is a life-saving medication that works by rapidly reversing the effects of opioids on the brain and respiratory system. It binds to the same receptors as opioids, effectively displacing them and restoring normal breathing. This is crucial because opioid overdoses can quickly lead to respiratory depression and death if not treated promptly. You might also see other options like atropine, flumazenil, or vitamin K on different slides, but for opioids specifically, naloxone is the go-to antidote. Remember, timely administration of naloxone can be the difference between life and death in these situations. So always keep it in mind when managing suspected opioid overdoses. Today, I want to emphasize the importance of the correct position for a post-operative unconscious patient. Among the options listed, supine, side-lying, Fowler's, and high Fowler's, it's crucial to choose the position that best maintains airway patency and prevents aspiration. The correct answer here is side-lying. The side-lying position is especially important because it helps keep the airway open and reduces the risk of choking or aspiration, which are significant concerns after surgery when the patient is unconscious. This position also promotes better drainage of oral and nasal secretions, minimizing the risk of infection or complications. By placing the patient on their side, we support airway management and enhance overall safety during their recovery. So, whenever caring for a post-operative unconscious patient, always remember that side-lying is the most appropriate and safest position to promote their well-being. When we're looking at expected findings in anemia, fatigue is one of the most common and telling symptoms. It's not just feeling a little tired, it's a persistent sense of exhaustion that doesn't improve with rest. This happens because anemia reduces the oxygen-carrying capacity of your blood, so your tissues and organs don't get enough oxygen to function optimally. As a result, you feel drained and weak, even after minimal activity. Recognizing fatigue as a key sign helps us identify anemia early, especially when combined with other signs. It's a crucial piece of the puzzle in understanding the overall clinical picture and guiding us toward proper diagnosis and management. All right, let's talk about the best site for checking the pulse in infants. When assessing an infant's vital signs, it's crucial to choose the most accessible and reliable pulse point. Among the options, carotid, radial, brachial, and femoral, the brachial artery is considered the best site for this purpose. This is because the brachial pulse is easily accessible on the upper arm, just above the elbow, making it ideal for infants who may be crying or uncooperative. It also provides a strong and palpable pulse, which is essential for accurate assessment. Checking the brachial pulse allows us to gauge the infant's heart rate effectively, especially when other signs are inconclusive. So, in clinical practice, when we need to quickly and reliably check an infant's pulse, the brachial site is our go-to. This choice aligns with the overall theme of selecting appropriate, age-specific assessment techniques to ensure accurate and efficient vital sign measurement. Now, looking at this slide, the question is, which of these signs is an early indicator of hypoxia? And the answer is confusion. It's important to recognize that confusion often appears early when the brain starts to be deprived of oxygen. This can be a subtle sign but a crucial one, because if we catch it early, we can intervene before more severe symptoms like apnea or unresponsiveness develop. Cyanosis, for example, tends to be a later sign, indicating more significant oxygen deprivation. So, understanding that confusion is an early sign helps us act quickly to prevent further deterioration in the patient's condition. Remember, early detection of hypoxia can make all the difference in patient outcomes. Now, when it comes to administering digoxin, one of the most important assessments the nurse needs to perform beforehand is checking the apical pulse. This is crucial because digoxin has a narrow therapeutic window, and administering it without verifying the heart rate could lead to serious complications. Specifically, we need to ensure that the apical pulse is within an acceptable range, usually above 60 beats per minute, before giving the medication. If the pulse is too low, administering digoxin might worsen bradycardia or cause other adverse effects. Remember, the apical pulse gives us the most accurate measurement of the heart's activity, especially when we're dealing with medications that influence cardiac function. So, always take that extra moment to assess the apical pulse carefully and compare it to the prescribed parameters. This step is a vital part of safe medication administration and helps us prevent potential toxicity or side effects. It's a simple yet critical check that ties into our overall goal of providing safe, effective care. All right, let's talk about normal fasting blood glucose levels. The typical range is between 70 and 100 milligrams per deciliter. This is considered healthy and indicates that your body is managing blood sugar effectively without any issues. If your levels are consistently within this range, it usually means you're at low risk for diabetes. It's important to understand this because maintaining blood glucose within this range is key to overall metabolic health. When levels go above this, especially into the 120 to 180 mg/dL range, that might suggest insulin resistance or prediabetes. Conversely, levels below 70 could indicate hypoglycemia, which also needs attention. So, aiming for that 70 to 100 mg/dL range is a good goal for overall health. The very first step before we start suctioning a patient is to administer oxygen. This is crucial because suctioning can sometimes cause a temporary drop in oxygen levels, and providing supplemental oxygen helps ensure the patient maintains adequate oxygenation throughout the procedure. By doing this first, we help minimize the risk of hypoxia and keep the patient safe. Remember, always prioritize oxygenation before any invasive steps to promote the best outcomes and patient comfort. When it comes to dealing with a choking adult, the most important action to take is the Heimlich maneuver. This technique is specifically designed to quickly dislodge an object blocking the airway. Unlike back blows or chest compressions, which are useful in different situations, the Heimlich maneuver targets airway obstruction caused by food or other objects. It's crucial to act swiftly and confidently because a blocked airway can lead to serious injury or even death if not addressed immediately. Remember, the key is to apply quick, upward abdominal thrusts to create enough pressure to expel the object and restore normal breathing. This is a priority action, and mastering it can make a life-saving difference. All right, let's look at the options here. We have warm skin, high blood pressure, tachycardia, and slow respirations. When considering signs of shock, which of these stands out most? The key point is that in shock, the body initially responds with a rapid heart rate to try to compensate for reduced blood flow. That means tachycardia is a common early sign. Warm skin, on the other hand, can sometimes be misleading because early shock may cause skin to feel warm and diaphoretic. High blood pressure is usually not present in shock. In fact, blood pressure often drops as shock progresses. Slow respirations are less characteristic. More often, you might see rapid, shallow breathing. So, among these options, tachycardia is the most indicative sign of shock, signaling the body's attempt to maintain perfusion. Remember, recognizing tachycardia early can be crucial in identifying shock and initiating prompt treatment. In most cases, a nurse should check the apical pulse for about 60 seconds. This longer duration is especially important when assessing irregular heart rhythms, such as irregular beats or murmurs, because it provides a more accurate count. Unlike checking the radial pulse, which may only take 15 seconds, and then doubling the number, the apical pulse requires a full minute to ensure precision. This allows us to detect any irregularities in heart rate or rhythm that might be missed with a shorter count. Remember, accurate assessment of the apical pulse is essential for evaluating cardiac function, particularly in patients with known or suspected heart issues. So, taking the full 60 seconds helps us gather the most reliable information to inform our care and treatment decisions, aligning with our overall goal of providing thorough, patient-centered nursing care. The standard needle size for subcutaneous injections is typically in the range of 25 to 27 gauge. This size is most commonly used because it provides a good balance between patient comfort and effective delivery. Thinner needles, like 25 or 27 gauge, tend to cause less discomfort during injection, which is especially important for patients who require frequent shots. Additionally, these gauges are ideal for injecting medications into the subcutaneous tissue because they allow for smooth, controlled delivery without excessive tissue trauma. Remember, choosing the right needle size is crucial for both comfort and efficacy, and for subcutaneous injections, the 25 to 27 gauge range is generally considered the standard. All right, let's look at this question. Which lab increases in infection? The options are RBC, WBC, platelets, and potassium. Now, the key here is to understand what each component indicates. Red blood cells, or RBCs, primarily carry oxygen. Platelets are involved in clotting. Potassium is an electrolyte important for cellular function. But when it comes to infection, the one that tends to increase is the white blood cell count, or WBC. White blood cells are part of our immune response. They increase when there's an infection fighting happening in the body. So, the correct answer here is WBC. Keep this in mind because tracking WBC levels is crucial in diagnosing and monitoring infections. The best way to reduce medication errors is by following the 7 rights. This means ensuring the right patient receives the right medication, at the right dose, at the right time, through the right route, for the right reason, and with the right documentation. Sticking to these principles helps us catch potential mistakes before they happen. It's a simple but powerful way to improve patient safety and make sure our medication practices are as accurate as possible. Remember, consistently following the 7 rights is central to providing safe, effective care. Today, we're focusing on what to watch for in patients taking diuretics, specifically the electrolyte imbalances they can develop. One of the key concerns is hypokalemia, which is a low potassium level in the blood. When patients are on diuretics, especially certain types like thiazides or loop diuretics. They tend to lose potassium through increased urine output. This can lead to muscle weakness, cramping, fatigue, and even more serious issues like irregular heart rhythms. It's important to monitor potassium levels regularly in these patients because maintaining proper potassium balance is crucial for overall cellular function and cardiac health. If hypokalemia is left unchecked, it can predispose patients to arrhythmias, which ties into our overall discussion on electrolyte management and patient safety. So, in summary, always keep an eye on potassium levels in patients on diuretics, because hypokalemia is a common and potentially dangerous complication that requires prompt attention to prevent serious adverse effects. Let's talk about the best indicator of fluid balance. When we're assessing a patient, one of the key things we look at is their weight. Changes in weight are actually one of the most reliable signs of fluid gain or loss. For example, a sudden increase or decrease in weight over a short period can indicate fluid retention or dehydration. While pulse, respirations, and skin color are important vital signs and physical indicators, they don't always give us a clear picture of fluid status on their own. Weight gives us a tangible, measurable way to track fluid balance over time. So, if we're trying to determine whether a patient is retaining fluid or becoming dehydrated, monitoring their weight regularly is essential. It provides us with a concrete, objective measure that helps inform our care decisions and interventions. Remember, consistent and accurate weighing at the same time each day is key to getting the most useful information. All right, let's focus on the primary goal of infection control, which is to prevent the spread of disease. This is really the cornerstone of all our efforts in healthcare settings. When we talk about preventing the spread, we're aiming to protect both patients and staff from harmful infections. It's about implementing practices that stop germs from moving from one person to another, whether through contact, droplets, or contaminated surfaces. By doing so, we not only safeguard individual health, but also reduce the risk of outbreaks within the facility. Remember, effective infection control measures directly contribute to safer environments and better health outcomes for everyone involved. So, the main takeaway here is that preventing disease spread is at the heart of our infection control strategies. Today, I want to focus on the best technique to collect a sterile urine specimen. When we're working with patients who have a catheter, it's crucial to obtain the sample in a way that maintains sterility. Now, among the options, bedpan, catheter port, urine bag, or bedsheet, the correct answer is the catheter port. Using the catheter port is important because it allows us to collect urine directly from the catheter without contaminating the sample. This helps ensure the accuracy of lab results and prevents infections. It's essential to disconnect the collection syringe carefully from the catheter port, clean the port with an alcohol swab first, and then attach the syringe to draw the urine. Remember, maintaining strict aseptic technique during this process is critical to prevent introducing bacteria into the urinary system. So always choose the catheter port for sterile urine collection, as it's designed specifically for this purpose and helps us deliver the safest, most accurate care to our patients. Now, before we proceed with the blood transfusion, one of the most critical steps is to check compatibility. This means verifying that the donor blood matches the recipient's blood type exactly. It's essential to prevent any transfusion reactions, which can be serious. Always double-check the blood type on the label and compare it with the patient's identification and orders. Remember, proper compatibility testing is key to ensuring patient safety and the success of the transfusion. So never skip this step. It's a vital part of the process. Let's take a closer look at the vitamins listed here. We have vitamin A, vitamin C, vitamin D, and vitamin K now. The question is, which vitamin is needed for wound healing? The answer is vitamin C. This vitamin plays a crucial role in repairing tissues and supporting the immune system, which are essential for proper wound healing. Without enough vitamin C, wounds can take longer to heal, and the risk of infections increases. So, ensuring adequate intake of vitamin C is vital for recovery and maintaining overall health. This ties into our broader theme of understanding how vitamins contribute to different bodily functions and health maintenance. The correct answer here is weight loss. When we think about hyperthyroidism, one of the hallmark features is an increased metabolic rate, which often leads to unintended weight loss despite normal or increased appetite. This is quite different from other conditions that might cause weight gain or cold intolerance. It's important to remember that hyperthyroidism also presents with symptoms like rapid heartbeat and heat intolerance, but weight loss stands out as a key clinical finding. Recognizing this helps us distinguish hyperthyroidism from other thyroid or metabolic disorders in our diagnostic process. When a patient falls, the most important thing we can do is assess the patient before moving them. This means taking a moment to check for injuries, pain, or any signs that might indicate a serious problem. Rushing to move them without assessment can cause further harm. Remember, the priority is their safety and well-being. Once you've evaluated their condition, you can decide on the best course of action, whether it's calling for additional help or gently assisting them to a safe position. Always keep in mind that thorough assessment helps prevent additional injury and guides your next steps.